Cracking the weight loss and health code. I love helping people lose weight and get healthy. Recent members that went through the 7 Systems plan, she's still working but lost 50 pounds in 14 weeks. And do you think she feels better? I love helping people do this. Diane from Iowa just wanted to feel better and look better and improved her health tremendously. Jessie in South Carolina, high school girl, wanting to look better for college, and look what happened to her. Dan, I see people like this all the time in my office, and I wonder what kind of a retirement are they going to have? Well, he's going to have a great one now because he applied what you're going to learn tonight. Thank you for joining me. My name is Dr. Pat Luce. I am the president of Tri-State Physicians Clinic in South Sioux City, Nebraska, and we have one of the largest health and weight loss practices in the Midwest. This is my family. I married my high school sweetheart. We had 4 children and adopted 4 children, and now we have 12 grandchildren. I love my family, I love God, and I love helping people improve their health. So I want to talk to you for just a few minutes about the difference between health span and lifespan. Your lifespan is the total years that you live. Most people know that. But your health span is the part of that time where you are healthy and enjoying life. And in America, about 1/3 of our life, unfortunately, is spent in poor health and disease and medications and low energy, and that's no fun. Now, the good news is you can change that. You can do things to make you live significantly longer and compress that period of time where you're not doing well to a very brief time. So let's talk about cracking the weight loss and health code with the 7 Systems plan. Wouldn't it be great if we could just spin the dial and that happens? Well, there is a way to make that happen, and it is a 7 Systems plan. So on the course, we help people with weight struggles, but it's far more than that. We fix digestive problems, blood pressure and cholesterol issues, low energy problems, hormone problems, diabetes, autoimmune disease, and much more. And I want you to stay with me because I'm going to give you a free hormone test in just a few minutes. I've been searching for the code to help people get healthy and lose weight for decades now. That's actually a picture of me in 1980 searching for the code. And when I wanted to come up with a perfect plan, here were the requirements. It had to unlock fast weight loss and great health. I want people to lose weight quickly. It had to be simple to do, easy to maintain. There's no use losing weight unless you regain it, cause no harm, and it had to fix the cause of what had made you gain weight and have health problems. Now, before we get into the code, I want to show you codes that do not work. And here's a biggie: keto diets. And I've got studies to support everything that I do in my plan. Here's one on keto versus higher carbohydrate diets. 17 men are placed in a program. First 4 weeks, they're on a higher carb diet, and then they switch them over to keto and see what happens. Well, here's what happened on the higher carb diet, but when they switch to keto, the weight loss appears to increase significantly. However, when they looked at their body composition, fat loss slowed down on keto. In fact, it slowed down by half. Now, if you're not losing fat, what are you losing? You're losing water or muscle mass, which is not good. And there is a risk of cardiac death on keto programs. And the final thing for me was Lancet, one of the most prestigious medical journals in the world, 2018 said you have a 32% higher risk of all causes of death over a 6-year period if you're using keto. And here's a code many of you have used: eat less, exercise more. And how does that work? Not the best. You look at the biggest losers, most people are familiar with that, very rapid weight loss. However, 13 of 14 regained the weight. 4 were actually heavier than before. And here's the biggie: almost all of them slowed their metabolism down by 400 to 800 calories a day. That makes it almost impossible to maintain your weight loss when your metabolism slows down. And the last code that does not work: how about weight loss drugs? Have you seen a commercial for weight loss drugs recently? I've been following these drugs since 1990. Fin was the first, looked extremely promising, rapid weight loss. However, heart valve lesions made him withdraw it from the market. Rimonabant was the next one that looked promising, but it made people have suicidal tendencies, withdrawn from the market. And then Ozempic. You've all heard about Ozempic. One last one that came up was Zepbound. Now, here's a problem with all of these weight loss drugs. The cost is prohibitive, up to $1,500 a month. There's undesirable and significant side effects. And discontinuing these drugs means what's going to happen? You're going to gain all the weight back unless you have changed your lifestyle. One study showed that when you stop them, the appetite comes back in spades. That's going to make it very difficult. Almost every weight loss drug has been withdrawn from the market. I don't expect anything different from the most recent one. You're already seeing ads pop up for lawsuits against these current weight loss drugs. So we're looking for a practical, safe solution that gives you all the benefits of the weight loss drugs, but has a side effect of making you healthy, and that is the 7 Systems Plan. Now, if I go back 22 years ago, I went through functional medicine training, which is extremely good training. It teaches you about the 7 systems in your body. Now, these systems control everything almost. Your health is all in these 7 systems. And one of my biggest takeaways from that training was that any system can block weight loss and impair your health. So the solution to weight loss and health problems is to get each of these 7 systems working correctly, which functional medicine is very good at helping happen. So there's the code for getting these 7 systems working correctly and helping you lose weight. After doing functional medicine for a couple years, I found a couple problems. Number one, it's very complicated for patients and very difficult to maintain. And also, it's very expensive. You can spend tens of thousands of dollars doing that. So I continued my search and made a discovery. There is a simple way to evaluate these 7 systems, identify system malfunction, and then optimize your systems using simple, proven steps. And I started helping people like Mark and Pam. Now, Mark was actually tracking his weight loss on a fitness app, and dieting and exercising for 1 year, he lost 5 pounds, which is better than most people do, believe it or not. Right there is where he attended this free training and began the 7 Systems Plan. He hit his goal in a short period of time. He and his wife lost over 100 pounds and got off most of their medications. Kevin was morbidly obese, 170 pounds of weight loss. Dustin and Sarah, now that is their weight loss in the first week. You should lose weight rapidly if you're on a good plan. There they are, 270 pounds later. So after coaching people one-on-one, I started coaching groups of people, and was having enough success that I wrote the book on what I do, the 7 Systems Plan, and then I put my plan online for people anywhere to go through to help them lose weight and get healthy. And I'm very honored that my course now is being used in almost every state in America and 7 countries around the world. I had doctors starting to ask me how to use the plan in their office, so we developed a program to help them implement it. And we now have doctors in 13 states that are using the 7 Systems Plan to help people. And people like Mike, diabetes, high blood pressure, high cholesterol, obesity, all problems gone in 90 days. Now, I do want to tell you about a patient I could not help. This is Sheila. She came actually to my office. She knew she had diabetes, high cholesterol, weight problems, and hypertension. And we did some testing on her because of everything that was going on. And I found problems with all 7 systems. Now, that's not very common, but when I find that, that's a big red flag. And I told Sheila, you're going to have a train wreck if you don't fix your systems. Unfortunately, Sheila was not willing to make any changes. And I tell people, if you're not willing to make changes, come back to me when you are. And sure enough, this is what happened to Sheila. She ends up in a coma in the hospital for 6 weeks and almost dies. When she comes out of the coma, she's got twice the health problems, twice the medications, but now she was willing to make some changes and jumped into the 7 Systems course and got off all of her medications and got rid of all of her diseases. So I'm going to go through these codes quickly with you, the 7 systems codes. The first one is eliminate angry fat. Angry fat can be part of your structural system. Candy had problems with angry fat. And I want to tell you, your fat cells are not supposed to be angry. They should be happy. They should be helpful. They help regulate energy, insulin, appetite, your inflammatory response. They're a very important part of you. However, when you stuff these fat cells more and more, they become angry, and now they don't help you. They sabotage your health. Where's the worst place to have body fat? In the belly. This is a healthy cross-section of a belly. Liver, intestines, muscles, spine, and there's a little fat in there. Where are the organs? Over here. When you have belly fat, you have fatty liver, you have fatty heart, and the organs don't work correctly. We need our abdomen to look like this. On the 7 Systems Plan, we have a 3-step plan to get rid of angry fat. Do you know there's a magical time of day when calories almost do not count. Here's a study where people were assigned to one of two groups. They are both eating exactly the same thing, 2,000 calories. One group gained weight, the other group lost 3 pounds. We'll teach you about when to consume most of the calories on the 7 Systems Plan course. The second thing to get rid of angry fat is to understand your body does not like it when you do the same thing every day. And that's what we kind of do when we get on a diet plan. If you mix it up, change your routine, you lose weight a lot faster and you keep it off a lot easier. The third step involves your weight loss hormone. Do you know you have a weight loss hormone? It's called leptin. Leptin decreases appetite, increases fat burning, and keeps you from gaining weight. Unfortunately, most people have leptin that's not working, but we can get it working again. Back to Candy. In 1 year, she lost over 100 pounds. Now that was 15 years ago. Would you like to see what Candy looks like today at age 73? There she is with one of those grandkids she wanted to be around for. Julie in Ohio went through the online training and lost a lot of weight. Mike in Nebraska, Brandy in Iowa. Now 10 years later, do you think she looks younger than she did at age 30? I always warn people, you might have to buy some new clothes if you go through the 7 Systems Plan. It's a nice problem to have. Code number 2 is to fix your microbiome. Your microbiome is your gut bacteria. You've been hearing a lot about that, no doubt. In the course, we'll go through every part of the digestive system, and you'll understand how to make it work correctly. But Lucinda came in to see me for morbid obesity, out of control type 1 diabetes, and digestive problems. Now that was a big flag for me. She had all of these digestive symptoms. So what we did was focus on her digestive system. Your gut microbiome, your gut bacteria, significantly control your brain. They determine what you eat, when you eat, and how much you eat to a significant degree. Now here's the problem. You can have good bacteria in your gut which turn off hunger, that'd be all right, decrease inflammation, and signal your brain to make good food choices, or you can have bad bacteria which do just the opposite. If you've been on antibiotics, you have eliminated 3.5 pounds of bacteria in your gut. That's how much you have. It's all gone if you go on antibiotics. How long do you think it takes that bacteria to come back? Up to 2 years, studies show. Now that's a very, very, very harmful thing. Medications also destroy the gut bacteria. Antidepressants, diabetic medications, blood pressure medications kill the bacteria. Antacids kill the gut bacteria. And how about Splenda? Artificial sweeteners. Here's what a study from Duke University showed. 1 packet of Splenda, half your gut bacteria is gone. If you drink Diet Pop, you have no good gut bacteria. And it's a huge factor in weight loss. That's the difference that just gut bacteria can make in your weight. Fortunately, there are some very good products you can use. There is a specific type of probiotic that was used in this 6-month study on humans. They didn't diet, they didn't exercise, they just took the probiotic and it helped them eat 300 calories less per day because it turned off hunger. So that's one of the things we did with Lucinda. Her and Monty lost over 250 pounds, and her insulin requirements as a type 1 diabetic went down by 2/3, and she was a happy patient. Larry went through the program just to help his wife out and ended up losing 50 pounds and getting off all 10 of his medications. Code number 3 is to deliver the best food. That's your delivery system. So you eat the food, digest the food, and then you deliver it to the cells in your body. In coming up with the 7 Systems Plan, I looked at all of the best diet programs out there, and I took the best parts of each and combined them to make the 7 Systems Plan. And it's a simple plan to follow. We give you a shopping list and tell you, eat the green foods, stay away from the red, and we're going to help you learn how to get foods from each of those groups because they all help the systems in your body. And I don't want you to eat less, I want you to eat more to lose weight. But we're going to have you eat different. We'll give you lots of recipes and menus, and we'll help you substitute some things. Now, pastas are very bad, but there are pastas made out of chickpeas that are actually very good for you. Potatoes, real high glycemic index, but cauliflower rice, very low and very good for you. Refined grains are bad, but whole grains are very good. And how about nuts? Should you be eating nuts? Absolutely. A small handful of nuts every day will decrease all causes of mortality by 20%. Another thing we do to help make it simple for you, my wife is the master chef in my house, and she has the 7 Systems Kitchen, and she makes recipes and menus for you that are easy to put together and very tasty, and follow the plan very closely. And we'll even teach you how to eat out and make good choices when you eat out. So Rhonda in Texas, cholesterol of 290, obesity, liver that was fatty, and in 6 months, all of those problems are gone. Denny was on high blood pressure medication for a long time, and you should work to get off those meds. He got off them in a few months, and his blood pressure is great. Code number 4, I want you to double your mitochondria. So now the food is delivered to your cells, and in the cells of your body, you have little factories called mitochondria. They take that food and turn it into energy, and they're very powerful. They are 10,000 times more powerful pound for pound than the sun, but they're also kind of fragile. And by age 50, you probably have lost half your mitochondria if you're not working on things. Any of you remember this TV show, Dukes of Hazzard? If you're old enough, you remember that. Bo and Luke, lots of energy, right? Not so much for Uncle Jesse. You should have tremendous energy in your 60s. I'm 68 today. I played tennis for an hour and a half over my lunch hour, and I'll work 10 hours today. If your mitochondria are working right, you'll have lots of energy. Alice had no energy, obese, 8 prescriptions. She just wants to feel good again. Well, she had depleted her mitochondria. And one of the things you can do to deplete your mitochondria, late night eating. That is a mitochondria killer. On the 7 Systems plan, she optimized her mitochondria, and her energy went up tremendously. She went back to her doctor, and he took her off all 8 of her medications, and she was a ball of energy with 600% more. Kevin in Iowa, always overweight, the team sports manager, never played sports until he went through the 7 Systems plan, and then he was running cross country. Code number 5 is to make your hormones work for you. If you're doing a plan that doesn't fix hormones, it will fail. You have to fix hormones. You'll learn about the 7 key hormones and how to optimize them going through the 7 Systems plan. I'm going to talk about one of them, and that hormone is insulin. Now, insulin is your fat storage hormone. In this study of 208 healthy people over an 11-year period, they found that people with high insulin had more obesity, heart disease, hypertension, stroke, cancer, and diabetes. And the people with low insulin had none of those and no weight problems. Keeping your insulin low is very important. Jody, a school teacher, dieted and exercised for 6 months at the advice of her doctor and lost nothing. She had food cravings, poor diet, no energy. So we checked her insulin, and it was 3 times higher than normal. That's why she could not lose weight. It should be less than 5. Now, you can have a blood test for insulin to see where your insulin is, or right now, you can all check your insulin by doing this and pinching right here. The more you have to pinch here, the higher we'll find your insulin. That's called the pinch test. It's actually quite accurate. Here's what the studies show. The release of fat from fat cells is inhibited by insulin. Your insulin's high, you can still put fat into the cell, you can't get it out. So you gotta lower insulin, and that's what we did with Jody, over 60 pounds in 6 months. 2 more codes, stick with me. Code number 6 is your gut lymph tissue, and you may never have heard of that, but this has to do with your defense or your immune system. Gut lymph tissue is a big part of that. In fact, 70 to 80% of your entire immune defense system is in your gut. Cindy had chronic inflammation. Now, if you've got chronic inflammation, you have a gut lymph tissue problem. But we fixed her defense system, and she couldn't get down on the floor to play with her grandkids here. Do you think she can get down on the floor now? Marla, fibromyalgia, severe fibromyalgia, an autoimmune disease for 20 years, had to shop with a cart like this. In 6 months, all of her pain is gone, and she's down 65 pounds. The last code is to eliminate toxins. Toxins are a serious problem today, and that's where your detox system comes in. You've got 5 major organs, and among these, the liver is extremely important. Steve found out he had fatty liver disease. And his doctor's warning him his liver enzymes are so high he's going to need a liver transplant if this continues. In 6 months, he doesn't have a fatty liver, his liver enzymes are perfect, and he's down 60 pounds. So let me just make sure you have the big picture for weight loss. If you have 3 plants that are dying, and you give 1 sunlight, 1 water, and 1 plant food, will any of them live? No. How about if you give all 3 things to 1 plant? Yes, it will. You see how to lose weight and get healthy, you have to fix each of those 7 systems, and then you'll have ideal health. So the keys to the best weight loss plan, if you're looking for any plan, it's got to have these 7 keys. These are critical. I want to talk about one part of that, and that is education. The 7 systems plan is one of the most thorough education plans there is. You'll know how these systems work, what can go wrong, and what to do to fix them. And you can attend the 7 systems plan live at one of our provider offices across the United States. Now, if there's not a provider near you, don't worry about it. You can join the course online and watch the recordings of these courses. It's pretty simple. We just ask you to go through a video a week. And in 6 months, you will have turned your health around tremendously. That would be wonderful if that's all you got, but I give you a lot more. We give you every tool I have found to be helpful to get you to regain your health. We give you bonus lessons in addition to those. I've got a whole lesson on food addiction. A lot of people are food addicts. We'll rate you to see how much of a food addict you are, and we'll help you break that addiction. We've got a lesson on spicing up your love life. That's a great one. We've also got a private community for the people that go through the course, and you can join that. We've got over 2,000 members in there. We give you a workbook to go with the course. I'm going to have you take a few notes and give you a few action steps to plug in. And we also give you a great price on all supplements. If you're low in some supplement, we'll give you a great price on that. So wrapping it up, it's time to decide, time to take action. Wayne, poor health in that red zone, went through the 7 systems plan, lost 60 pounds, got off all of his medications, and here's what he said: I feel 30 years younger. And his body was 30 years younger. If you want to think about doing this, I'm going to show you what happens thinking about doing this for 90 days. Nothing happens, so I encourage you to take